The Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine organized a data analysis workshop for nurses and midwives.
Generation is arguably a defining characteristic of most scientific professions, perhaps even more so in the clinical sciences because lives are at stake. So with this workshop, all we sought to do was to expose nurses and midwives to basic techniques in data analysis as well as open source software they can use. And we expose them to this broad ecosystem within which data analysis occurs, essentially to let them know what tools and techniques are available and, more importantly, how much more powerful their clinical practice can be when they apply scientific data analysis to their work.
The workshop followed a grant award to Kweku Ibrahim Dia, a nurse and data analyst for the group.
For most participants, the software was very new to them, and the first time they heard of Jamovi was during the application for the program. I think it was very helpful because it has a simple, intuitive interface which they could follow for the program.
The grant, awarded by the Global Research Nurses through the Burdett Trust for Nursing, aims to train early career researchers from the nursing and midwifery field in data analysis.
I came here expecting to understand and learn more about data analysis. So far, I have been thrilled by what I have learned about data, what it is, and how to analyze data.
The facilitators present in a very easy to understand manner so that even nurses and midwives who had never been in the research area can easily understand the concepts of software analysis.
I came straight from Azim for the program. I was expecting they would start from a higher version of data analysis, but so far so good. They started from the basics of data analysis.
I have learned certain things today that I didn't know, like the T-test and all those things. I didn't have the idea of those things, but coming for this workshop today has really given me something different, which I think is very, very important.
As a research nurse who wants to venture into clinical trials, and I've learned how to compute figures, make analysis, and this will help in clinical decision making.
We actually expected people who had very little skills as far as data analysis is concerned. We have really empowered individuals, nurses, midwives, and others. So we go out there back to respective hospitals or health facilities and be able to garner insights from the data that is all around them.